Wendell Potter joins us now. Welcome to the Journal.
Thank you very much for having me here.
You worked for CIGNA 15 years and left last year.
I did.
Were you pushed out?
I was not. I left. It was my decision to leave, and my decision to leave when I did.
Were you passed over for a promotion?
Absolutely not, no.
Had you been well paid and rewarded by the company?
Very well paid, and I, over the years, had many job opportunities, many bonuses, salary increases, so no, I was not. And in fact, there was no further place for me to go in the company. I was head of corporate communications, and that was the ultimate PR job.
Did you like your boss and the people you work with?
I did, and still do, and still respect them.
And they gave you a terrific party when you left?
They sure did, yeah.
So then why are you speaking out now?
I didn't intend to until it became really clear to me that the industry is resorting to the same tactics they've used over the years, and particularly back in the early 90s when they were leading the effort to kill the Clinton plan.
But during this 15 years you were there, did you go to them and say, you know, I think we're on the wrong side. I think we're fighting the wrong people here?
You know, I didn't, because for most of the time I was there, I felt that what we were doing was the right thing, and that I was playing on a team that was honorable. I just didn't really get it all that much until toward the end of my tenure at CIGNA.
What did you see?
Well, I was beginning to question what I was doing as the industry shifted from selling primarily managed care plans to what they refer to as consumer-driven plans. And they're really plans that have very high deductibles, meaning that they're shifting a lot of the cost of health care from employers and insurance companies to individuals. And a lot of people can't even afford to make the co-payments when they go get care as a result of this. But it really took a trip back home to Tennessee for me to see exactly what is happening to so many Americans.
When was this?
This was in July of 2007.
You were still working for CIGNA?
I was. I went home to visit relatives, and I picked up the local newspaper, and I saw that a healthcare expedition was being held a few miles up the road in Wise, Virginia. And I was intrigued.
So you drove there?
I did. I borrowed my dad's car and drove up 50 miles up the road to Wise, Virginia. It was being held at the Wise County Fairground. I took my camera and I took some pictures. It was a very cloudy, misty day with it was raining that day, and I walked through the fairground gates, and I didn't know what to expect. I just assumed that it would be, you know, like a health booth set up and people just getting their blood pressure checked and things like that. But what I saw were doctors who were set up to provide care in animal stalls, or they'd erected tents to care for people. I mean, there was no privacy. In some cases, and I've got some pictures of people being treated on gurneys on rain-soaked pavement. And I saw people lined up, standing in line or sitting in these long, long lines waiting to get care. People drove from South Carolina and Georgia and Kentucky, Tennessee, Virginia, all over the region because they knew that this was being done. A lot of them heard about it from word of mouth. There could have been people, and probably were people that I had grown up with. They could have been people who grew up at the house down the road, in the house down the road from me, and that made it real to me.
What did you think?
It was absolutely stunning. It's like being hit by lightning. It's almost like, what country am I in? It just didn't seem to be a possibility that I was in the United States. It was like a lightning bolt that hit me.
People are going to say, how could Wendell Potter sit here and say he was just finding out that there were a lot of Americans who didn't have adequate insurance and needed health care? He'd been in the industry for over 15 years.
And that was my problem. I had been in the industry, and I had risen up in the ranks, and I had a great job, and I had a terrific office in a high-rise building in Philadelphia. I was insulated. I didn't really see what was going on. I saw the data. I knew that 47 million people were uninsured, but I didn't put faces with that number. Just a few weeks later, though, I was back in Philadelphia, and I would often fly on corporate aircraft to go to meetings, and I just thought that was a great way to travel. It is a great way to travel. You're sitting in a luxurious corporate jet, leather seats, very spacious, and I was served my lunch by a flight attendant who brought my lunch on a gold rim plate, and she handed me gold-plated silverware to eat it with. And then I remembered the people that I had seen in Wise County. Undoubtedly, they had no idea that this went on at the corporate levels of health insurance companies.
But you had all these years seen premiums rising.
I had.
People purged from the rolls, people who couldn't afford the health care that CIGNA and other companies were offering. This is the first time you came face to face with?
Yeah, it was. I had, certainly I knew people and I talked to people who were uninsured. But when you're in the executive offices, when you're getting prepared for a call with analysts and the financial media, what you think about are the numbers. You don't think about individual people. You think about the numbers and whether or not you're going to meet Wall Street's expectations. That's what you think about at that level. And it helps to think that way. That's why that enables you to stay there if you don't really think that you're talking about and dealing with real human beings.
Did you go back to corporate headquarters and tell them what you had seen?
I went back to corporate headquarters. I was trying to process all this and trying to figure out what I should do. I did tell them about many of them about the experience I had and the trip. I showed them some pictures I took while I was down there. But I didn't know exactly what I should do. I had bills of my own, and it was hard to just figure out, well, how do I step away from this? What do I do? And this was one of those things that made me decide, okay, I can't do this. One of the books I read as I was trying to make up my mind here was President Kennedy's Profiles in Courage, and in the foreword, Robert Kennedy said that one of his favorite quotes was a Dante quote that the hottest places in hell are reserved for those who, in times of moral crisis, maintain the neutrality. And when I read that, I said, "Oh, geez, I'm heading for that hottest place in hell unless I say something."
Your own resume says, and I'm quoting, "With the chief medical officer and his staff, Potter developed rapid response mechanisms for handling media inquiries pertaining to complaints." Direct quote, "This was highly successful in keeping most such inquiries from becoming news stories at a time when managed care horror stories abounded." I mean, you knew there were horror stories out there.
I did.
You put these techniques to work representing CIGNA doing the Natalie Sarkeesian case, right?
That's right.
And that was a public relations nightmare, you called it, right?
It was. It was just the most difficult. We call them high-profile cases when you have a case like that a family or a patient goes to the news media and complains about having some coverage denied that a doctor had recommended. In this case, Natalie Sarkeesian's doctors at UCLA had recommended that she have a liver transplant. But when the coverage request was reviewed at CIGNA, the decision was made to deny it. It was around that time also that the family had gone to the media, had sought out help from the California Nurses Association and some others to really bring pressure to bear on CIGNA. And they were very successful in getting a lot of media attention, and nothing like I had ever seen before. It got everyone's attention. Everyone was focused on that in the corporate offices.